Good evening, and thank you for joining us for the final day of this special virtual education series from the National Lipid Association, Lipid PALOOZA, offered in celebration of National Cholesterol Education Month. My name is Melissa Goetz, and I am the co-founder and co-president of the FCS Foundation. My daughter Juliana was diagnosed with FCS at 7 weeks old. I am joined today by registered dietitian and clinical lipid specialist Mary Felando, who is a longtime supporter of the FNLA and the FCS Foundation. We are pleased to present tonight a session on practical recommendations for clinicians who are managing the care of patients with familial chylomicronemia syndrome and a special cooking demonstration. Note that the recipes we are using today are available for download in the handout section on your screen. If you have any questions for us during the session, please submit them through the Q&A section on the right-hand side of your screen. We will address as many as we can at the end of the presentation. Before we get started, we have one brief polling question on the screen. Please respond now. I am now pleased to welcome to the virtual stage, Mary Felando.
Hi, everyone. It was a lot easier when we were in a big room and all of our friends were there, and just kind of sad being here sitting in my living room all by myself. Can everyone hear me okay?
Yes.
Okay, good. So let's get started. And I guess you guys are all the die-hard lipid people here right to the bitter end, 5 to 6 on the east, 5 to 6 on the East Coast. I'm on the West Coast, and we just had a little earthquake this morning to increase the little jitters. Okay, disclosures. And just a couple disclaimers that the nutrition recommendations are based on this fabulous reference below, Williams et al. If you have FCS or have patients with FCS, they're going to see a registered dietitian who may not be a lipid specialist. This article should be sent a couple weeks in advance so the dietitian can take a look and actually try to practice some of those guidelines during those couple weeks, so they'll have a lot more empathy. Because I know that some of our FCS friends are sometimes disappointed by not getting the information they need from a dietitian. But this paper, I think, really changed everything because it gave us great comprehensive guidelines before which there were nothing. So the authors presented the best practices based on the literature and their experience with patients, but realized that due to the rarity of this disorder, there were no randomized controlled trials or meta-analysis. So that is why individuating approaches for success is really important, because it just depends on what someone does and then their response as far as their triglycerides go and their feelings of abdominal pain and general feelings of well-being. Also, I will be using some brand names, but they are used for convenience and in no way imply endorsement by the FNLA. Some of the objectives I hope to cover this tonight are to describe an FCS-friendly food plan that complies with the guidelines, to review options for substituting ingredients to make cooking tasty and easy, and to provide you with a cooking demonstration, which I did it myself in my kitchen with my cell phone. So we'll see how that goes. And I did incorporate MCT oil, very low-fat food ingredients, and low-fat cooking methods. So I hope that you'll be better equipped to counsel patients with FCS on nutrition recommendations. So what is FCS very briefly, because I know we already heard from Dr. Brown and Dr. Goetz a couple of weeks ago, but FCS is a rare autosomal recessive genetic disorder, and you may not see one ever because they're only about 1 to 2 per million. They have severe fasting hypertriglyceridemia, which is due to a defect in either lipoprotein lipase or the proteins that are needed for lipoprotein lipase function. Chylomicrons and triglyceride-rich particles are not metabolized and accumulate in the plasma. Sometimes the first thing you'll see is a blood draw like this one, where the blood is milky or very fatty. And then some physical symptoms might occur that would be abdominal pain and sometimes leading to acute pancreatitis, which results from the impaired pancreatic blood flow and an ensuing inflammatory process. Repeatedly, this can lead to chronic pancreatitis. And strict adherence to very low-fat eating is critical. And even when adherence is good, it's so sad that sometimes these triglyceride levels can remain high, and that is very frustrating for our FCS people. So let's take a look at the nutrition therapy for FCS. Limit fat to 10 to 15% of calories, or less than 15 to 20 grams of fat per day. It's also important on such a low-fat eating plan to meet recommendations for essential fatty acids that our body does not manufacture, and those being alpha-linolenic acid and linoleic acid, so we'll talk about those. Choose complex carbs and limit simple and refined carbs. So I know sometimes people, okay, it's low-fat, but yet it could be very high in sugar because, of course, we've got licorice and lots of fat-free candies, but this would increase triglyceridemia. Supplement with fat-soluble vitamins, minerals, and MCT oil as needed. Adjust calories for weight management combined with activity, and avoid alcohol. So these are the global recommendations, but now we're just going to do a little deeper dive in how we would explain this to a patient. So eat up to 10 to 15% of calories from total fat, or up to 20 grams of fat per day, and that's for someone eating about 2,000 calories. But remember, this does vary if you have patients with the individual. Include a source of essential fatty acids, linolenic and linoleic acid. So the linoleic acid, oh, I see I have a typo. No, linoleic. Okay, linoleic acid is an essential fatty acid, but it's more ubiquitous. It's found almost everywhere. So we don't usually present guidelines for linoleic acid, because if a person is eating lots of fruits and vegetables, and particularly whole grains contain linoleic acid, as Americans, we eat about 45% of our linoleic acid from soybean oil. So if there is a tiny bit of oil in cell walls, it usually contains linoleic acid. But the one that's tougher to get is the alpha-linolenic acid. And that is found in just a few places. And of course, both of these things are fat. So we're very limited in the amount that we can recommend. So it's usually about a teaspoon of chia seeds or milled flax per day. Can get you up toward the requirements, but this is individualized with a dietitian and your physician. We'll talk a little bit more about that. Select lean proteins like skinless poultry breast, which, even chicken contains a fair amount of fat for someone who needs to be as low fat as an FCS person. But turkey breast is fantastic. Shellfish, non-oily fish, egg whites, fat-free egg substitutes, beans, and powdered low-fat peanut butter kind of make up a lot of the protein foods. Include generous portions of vegetables, except avocado, of course, and moderate amounts of fruit. Even with some individuals who are very sensitive to sugars, they may be limited to 1 to 4 servings of fruit per day. And for kids, remember that fruit juice, that is any fruit juice, whether it's prepared with sugar or not, is not acceptable. Choose primarily whole grains like oatmeal, whole wheat bread and pasta, brown rice, popcorn, quinoa, farro. There's just so many more things on the market for people. And I think that a lot of them are so much fun. And they go into things like garbanzo bean and chickpea pastas, cauliflower, rice, things of that nature. There are so many great alternatives to refined grains, which should be limited, like white bread, crackers, and white rice. Use fat-free dairy products, minimize soda, sweets, and all foods processed with added sugars, eliminate alcohol, balance food intake throughout the day, including fat intake. Deciding, okay, I can have 15 grams of fat a day. I'm going to go out for dinner. I'm going to save it all for dinner. Just doesn't work for someone with FCS. It needs to be gradually throughout the day. And drink plenty of water to stay hydrated is so important, because this does decrease your chances of having acute pancreatitis. So let's take another look at it. For somebody that doesn't like a lot of words, we use this in our on FCS Focus for one of the webinars we did for the holidays. And it was a great visual that showed, you're going to do pretty good if you fill half your plate with vegetables, a little bit of fresh fruit. You've got your whole grains there, filling in with the lean protein and having some non-fat dairy. So that's it in a plate. If we were teaching a patient, we might take a look at the most important sources of fat. Of course, there's so many, but we might start with oils and butter, things that we cook with or things that we add to bread. So if instead of butter or margarine on the bread, we would look toward unsweetened fruit spreads, powdered peanut butter, fat-free butter spray. I do want to say something about, because it does have a very buttery taste, but if you look at labels like the butter spray, it looks like it's completely fat-free, and you can use 40 sprays for something and, kind of coat your popcorn with it. But in fact, when I check with the company, 10 sprays equals 1 gram of fat. So that's something to think about. Also, when it comes to PAM sprays and stuff, you really have to be very judicious in how you use that, because the fat intake of our FCS people is so low, and we have to be really careful. Non-fat yogurt cheese, taking non-fat yogurt and straining it through a coffee filter, a paper coffee filter, for 24 hours in the fridge, gives you a really nice spread for bread. You can add dill or you can add cucumbers, and I think a lot of the people learn to find some good things to put on bread: fat-free ricotta, cottage cheese, or fat-free cream cheese. Instead of oil to saute, fat-free broth or MCT oil, which we'll talk about more. Oil and butter for baking. There's so many great alternatives, especially for things like loaf cakes and muffins, using unsweetened applesauce, date puree, prune puree, yogurt, and even beans. I have a great recipe for an apple cake that uses pinto beans instead of oil. Instead of mayonnaise, luckily we still have fat-free mayonnaise available in the market and online. Fat-free yogurt can be used in salads and things, mustards, fat-free ranch dressing, and salad dressings. Of course, there's lots of good stuff, and we can make wonderful salad dressings with MCT oil. So what is MCT oil? It stands for medium chain triglycerides, which are 8 to 10 carbons in length. So caprylic acid is 8 and capric acid is 10. It is the only safe oil for use by people with FCS, as it is absorbed directly into the portal circulation and doesn't require hydrolysis by lipoprotein lipase. It should not be confused with coconut oil. Now, coconut oil contains MCT, but it only has about 15% MCTs. The rest is lauric acid and other long-chain fatty acids. So people would get way into trouble with coconut oil. Recommend, if you are recommending it, pharmaceutical or medical grade MCT oil that contains only caprylic and capric acid. Because this is kind of a hot thing now, I see it for keto diets, I see it for reducing belly fat, losing weight, getting in shape, and being, in sports, that MCT oil is almost used like a supplement for that. And you'll find it on many shelves. But if you look closely, it may not be all MCTs. And even if it says that it is, if it is an over-the-counter product, the FDA is not regulating whether that oil in that container actually is 100% MCT. So be very careful when you are getting things on the outside, and always check with your dietitian, physician, or other healthcare provider. And health professionals may want to provide a letter of medical food need to help with reimbursement. This particular MCT oil, you have to get 6 quarts of it at a time, and it costs $399. So that's a little expensive for almost everybody. So that's something to think about. Using MCT oil, if you're recommending it for a patient, you really need to introduce it gradually, because if it gets in there too quickly, it can cause abdominal pain, which a person with FCS is already worried about and very conscious of, nausea and vomiting. So they seem to be a little bit more sensitive to the MCT oil. So for people with FCS, recommend 1 teaspoon per day per meal, and if it's tolerated, then go up a little bit. Talk with a dietitian and work with them to look at, what would be maybe a goal for me as far as offsetting my carbohydrate calories with MCT oil, making foods taste good, but, really watching the amount. And some people can tolerate 3 or 4 tablespoons a day. And it really does give you 115 calories a tablespoon. So that's really helpful, because it's 115 calories that's not more carbohydrates going in. Because if you think about it, when you're eating a 10% fat eating style, and maybe you can get in 30% of your calories as protein and less than 60% carb, that's a tough one. And maybe you need a little edging off the carb so that you can pop up the calories. It can be added to smoothies, salad dressings, to keep foods from sticking on pans and grills, but realize it has a very low smoke point and burns very easily. So you really need to keep the temperatures low or medium. And a reminder that MCT oil is not the source of essential fatty acids. Essential fatty acids are the alpha-linolenic and the linoleic. Those are polyunsaturated fats that are long-chain fatty acids. MCT oil just contains the C8 and the C10, which are both of our medium chains. Okay, a couple more notes about fat, that we can increase calories and adjust macronutrient intake with MCT oil. An important thing if you are talking to someone and counseling them is that remember that nutrition labels round down. If it's so, it could really have 0.4 grams, and you eat 3 servings of it, and you're counting it as 0, but it really has 1.2. So it really leads to the underestimation of fat intake. And remember that things we don't even think about have fat, like an apple has a 0.4 grams, or strawberries, a cup has 0.4 grams, because it is part of cell walls. So that's something to think about, where if I'm counseling, I usually go under a little bit to account for those little bits of fruits and vegetables, and even some whole grains that don't have nutritional analysis or may say 0 when it really has almost 1. Monitor levels of fat-soluble vitamins and minerals, and there may be a requirement for supplementation, and then provide the alpha-linolenic and linoleic acid. And deficiencies can be seen as inadequate growth in peds, dry skin, maybe even bumps on the skin, dull, dry hair, nails, impaired wound healing. So supplements of those may be needed to correct the deficiency. And here you see selected sources of alpha-linolenic acid. We should all eat a little bit more of this, but we may have more fat to play with. So we could have a handful of chopped walnuts. You can see 1 tablespoon has lots of alpha-linolenic acid, but it has 4.6 grams of fat. So that's kind of out. But if you look at the USDA database for chia seeds, it's 1.4 grams, which I'm making a smoothie in the virtual cooking class, and that may give you an idea of, it's still a very low fat meal. And here's some other with the flax as well. Notes about protein: finding good sources and ready sources of protein are really important. Getting it very low fat, including it with meals and snacks. I love this Genio turkey breast because you can put it in the crock pot and it has 1 gram of fat and 3 ounces. A lot of people swear by fat-free cottage cheese as a wonderful protein source, and PB2 for smoothies or just making a peanut butter sandwich. Shellfish, I always feel shellfish is always in season because I'm from Maryland and we have lots of good crabs there. But to take a look at the shellfish, and believe me, some of it is expensive, but as far as fat goes, blue crab, clams, you can see everything is really, really low. And this is for 3 ounces of cooked fish. Shrimp, 0.2 grams for 3 ounces of shrimp. So people can eat a lot more and feel better not having such a tiny portion. And that compares to chicken breast, skinless meat only is 3 grams of fat. About carbohydrates, you want to aim for less than 60% of calories from the complex carbs. You may need to limit the amount of fruit, avoid sugar and sugar-containing added sugars. Whole grains, select legumes. That's something we can teach people, is to eat more beans and increase vegetable intake. 2020 was a bad year all around, let's face it, but it was a good year for the label because January of this year, all food products had to contain the new label. And the new label's been really good because it has a more realistic serving size. It always says fat, so that's something to look at. But it has the 10 grams of added sugar in this particular product, but it tells you about the added sugar. And what that's done that I have seen in the market right now is because people are looking at added sugars now and manufacturers have to have it on the label, now they're looking toward lowering the amount of added sugar in lots of products and providing no sugar added alternatives like barbecue sauce. And Hershey's chocolate syrup now has a no added sugar. So we're finding better products for our FCS people. This just shows a recipe makeover that that I did with original bread pudding that someone brought into our cardiac rehab program. And that was the recipe, and it was delicious, but I'm gonna tell you, it was just as delicious with 0.4 grams of fat by just switching to the whole wheat bread, the crushed pineapple in its own juice, adding Truvia instead of the sugar, using the fat-free egg sub, and baking it. And everybody can do their own favorite recipes at home and be switching them. And that way, our people that we're counseling will feel so much better about their eating. They love to talk about food, and nobody wants to eat food that doesn't taste good or food they don't like. So it's really finding things they like. And a lot of times that's taking the original recipes and making them a little bit better. As far as life stages goes, I have only had someone pregnant with 10,000 plus triglycerides, but not an FCS person. And there was one thing that I noticed. Our goal was to maintain less than 500. That's the goal, but monitor triglycerides and really follow closely. We used a lot of MCT oil. We did buy it from the Nestle Nutrition store because we wanted to be sure we were getting the best. We did supplement with omega-3s because she was responsive to that, which a lot of FCS patients are not responsive to medications. And we did have to count the fat in that. But the other thing that was really hard is you're looking at mercury and you're looking at protein and you're trying to up the protein, and you're limited because tuna and lots of fish contains lots of mercury. So it was a really hard finding protein sources. I'll let you read the infants and the toddler and the school age, and you'll have that. And really, Lauren Williams does work with pediatrics and did a good job in the paper on this topic. So take a look at that. And then I wanted to spend a minute just talking about the challenges to the FCS patient. And I really think about Lindsay Sutton, who was one of the authors of the Williams et al. Paper. And it was really amazing to hear about it through her point of view, having been diagnosed with FCS at 5 weeks old. And that's something you won't want to miss in the paper either. But this isn't a diet that you can go off of on Christmas, or you can go off of on a holiday or vacation. This is a day-to-day, every day, long-term. And there is an aspect of it that's tiring. And it's important to really come up with more food ideas, new food ideas, more satisfying food ideas. So there's a lot of boredom. There's need for easy recipes, because remember, people with FCS are often tired. Those triglycerides make people feel bad when they're high, and the fatigue, and so things need to be easy recipes and foods. And planning meals ahead is important, because you never know when you're going to get sick. So you're going to have lots of what I'll think of as our pandemic foods. We don't know if we can go out and get stuff, or things are going to. It's good to have things on hand. The next point, not always with it, because of the brain fog that they experience, the tiredness, the abdominal pain, and unplanned trips to the ER. Favorite fruit products may no longer be available. I don't know how many are out there looking for fat-free stuff, and I think some of our FCS patients have tuned in, but with the current high-fat trend, I'm worried about fat-free yogurt, because everything looks like it's 5% now. Difficulty eating away from home, travel, holidays, frustration that a person can feel that despite your best efforts, you still experience pancreatitis. There is a risk for disordered eating because of the strict guidelines and the emphasis on food. And I would say always refer your patients to a registered dietitian nutritionist for medical nutrition therapy. No one knows food like a dietitian. And I will say that the only people that like to talk about food more than a dietitian is an FCS person. So let's see, resources. There are so many good things. I mean, living with FCS, I looked at that today, and I listened to a dietitian from the UK. She was fabulous. YouTube, it was an hour long, and she did a great job. So there's so much education and support in the foundation, the FCS Foundation, that Melissa and Lindsay co-founded, and they are co-presidents. The foundation of the NLA has the learnyourlipids.com, and there's a fabulous cookbook. Lots of the dietitians I know made recipes that Naomi put together for us. And we also put some educational tear sheets. FCS Focus has patient stories. We have webinars and videos and handouts like you see below. There are some 1990s recipe books still on Amazon for pretty cheap prices, and they're secrets of fat-free cooking that you'll just have to maybe look at the sugar and replace the refined flours, but you can also find Italian, Indian, Greek, and Chinese. Sarah Schlesinger did a great fat-free recipe book, and the Everyday Cooking with Dean Ornish is very wholesome, and it's 10% fat. It is vegetarian, so if you're not, then you could just add in a little of the lean proteins. But those are some great ideas for you all. And our cooking demonstration will begin shortly.
Hi, I'm Mary Felando, registered dietitian, nutritionist, and clinical lipid specialist, and welcome to my kitchen. I am going to be preparing 3 recipes for you today, one considered a breakfast, one considered a lunch, and one for dinner. They will all be FCS compliant with the FCS friendly foods, which include pretty much no added fat, 10 to 15% of calories from fat. I think most of my FCS people probably stay under about 5 grams of fat per meal. Also, to make it a little bit more challenging, they minimize intake of refined grains. So you're looking at whole grains, fruits, vegetables, and things like that. And then the last part of the meal preparation is that things would contain no added sugars. So pretty tough road to go, but we do have new labels that clearly delineate how many grams of added sugars are in products. So that's good because it's also opened up the door for lots of new products coming on the market that don't have added sugars, because now everybody's looking at that and seeing what was in certain things. Anyway, I used to do cooking classes at Cedars-Sinai Medical Center, cardiac rehab in the 90s, so it was a pretty fat-free time with Dean Ornish and those eating styles. So I'm pretty well versed in altering recipes to make them still tasty, but without added fat. And I think a lot of chefs, if you're allowed to use butter and oils, and of course things should taste good, but this is just a little bit more fun because it's a little bit more challenging to find something that you would want to put on your menu. So that's what I'm hoping today, is that you'll find things that, whether you have FCS or not, I know some of the FCS patients are tuning in today, so welcome to them, and all the FNLA people. Do want to say that this is a very low budget. It's me taping myself on my phone, so we'll see how that goes, and I'll start the first recipe. So we're gonna do a peach smoothie with chia. So one of the things that with a very low fat eating plan, you really should be considering a source of essential fatty acids. Your body doesn't make them. And one of the best places to get an important essential fatty acid, alpha-linolenic acid, is with chia seeds. So we're gonna make a peach smoothie with chia seeds, and you can also use this for your breakfast, but you could also use it for dessert or snacks. So we'll start with a cup of no added sugar frozen fruit. So I'm doing peaches, but you can do pretty much whatever you like, whether it's blueberries. And it's nice to have frozen fruit, because if you're in the pandemic and not shopping as much as you used to, fruits are one of the first things to go. But if you have things in your freezer, then that's good. Sorry about that. Then let's see, we are going to add a half a cup of skim milk. And I don't know if you've noticed, but the milks today are lasting well into like the next few months. This one I think is all the way till January. So it really does cut down on waste, because they are now ultra pasteurized, and that reduces the bacteria. So they last a lot longer, but once you open it, you would use it for 7 to 10 days. So we'll put in a half a cup of skim milk, and we're also gonna do a half a cup of non-fat Greek yogurt. Non-fat Greek yogurt has a little bit more protein than other yogurts. Let me go get my spatula. Here we go. And if I could think of one thing to keep in my pantry or refrigerator all the time, it would be this Fage yogurt. It is fabulous. Every non-fat Greek yogurt's great, but you can use it for dips, you can use it for a meal, you can use it to replace oil in a loaf cake recipe. So it's a really good deal to have something so versatile. You could use it instead of mayonnaise in a mayonnaise-y type salad. So let's see, and then I'm gonna do the chia seeds, and chia seeds are kind of fun. They're kind of a new superfood, although they were introduced in the 80s with the Chia Pets, if anybody remembers that. But these chia seeds, a serving is 3 tablespoons, and that's 11 grams of total fat. So we know that's way too much. But if we just use a teaspoon, it gives a nice texture to the smoothie, and 1 teaspoon has about 1.1 to 1.4 grams of total fat, but you're also getting somewhere between 600 and 850 milligrams of alpha-linolenic acid, and the adequate intake that is recommended is 1.1 grams for women and 1.6 grams for men. So this just gives us a little bit of that what our body can't make. And I'm gonna go ahead and put a half a teaspoon of vanilla extract in to give it a little sweetness. Talk to your healthcare professional for the FCS patients that might be listening, because some people would even go and get alcohol-free vanilla extract because alcohol is not recommended for people with FCS. Now I'm going to use 2 packets of this stevia Splenda, but you may not need to put anything in. I like everything sweet, so we'll just blend this up. And what's good about the chia seeds is that they have a very delicate outside. They're related to a flowering plant from the mint family, and they absorb 10 times their weight in water. So they help to thicken things. You can throw it in so many things. I think I got it pretty good there. Let's see. And then that's about it. So we'll pour it out. You can freeze the leftovers too. This really made 1 serving for a breakfast or a couple servings for a dessert, but cheers. I guess for some people it is about that time, quitting time for the day. So yeah, tastes good. So that is your peach smoothie with chia seeds. Thanks. And now we're on to the next recipe, and that is a tuna pasta uncasserole. I grew up in a big family in Baltimore, and every Friday night, my mother figured out some way to make tuna. And thinking about the pandemic and having things on hand and things that you can store easily in your refrigerator or cabinets, nothing is better than this meal for that, because you can always have everything on hand, because it's basically a bunch of canned things and some pasta, so and some frozen peas. So let's look. So first of all, we're just gonna put everything into this baking dish. So I will be microwaving it because I'm into a faster time in the kitchen, but you can also bake it as well. So we will use tuna, solid white tuna in water. So you know that has almost no fat whatsoever. However, if you're pregnant or lactating, or children may want to talk to their physician about how much tuna can be had in a week due to mercury. We're going to add some, let's see, cream of mushroom soup, but we're using the Healthy Request mushroom soup, and it adds a little bit of fat, 2.5 grams per serving. But for the whole thing with no other added fat, each serving contains 3 grams of total fat. So we will put that whole can in here. I guess you could really make your own cream somehow with flour and skim milk, but this is so good and so fast. So the next thing, we'll use a half a cup of non-fat milk, which I need to run and get. So I will put in the frozen peas now. That were just peas from any peas, but without added fat. And then we're going to use a half a cup of non-fat milk and a small container of these diced pimentos. I think, oh, there we go. I usually use a small container, but I can only find big ones, so I'll just use half of that. And that gives it a nice red color. I am going to use a half a teaspoon of garlic powder. And here we go. teaspoon of garlic powder, and some black pepper. Now, sometimes people like it to have a little bit of a buttery taste, and for that I use the Molly McButter, but it's really not necessary, but you could use the Molly McButter. And we'll put in some mushrooms, and I usually use the 8-ounce can, but I got this one, which is 6 ounces drained weight, but that's gonna be plenty. And lastly, we have the pasta. Now, the way I do it is I think ahead to when I'm gonna make this meal, and maybe a day or two before I'll make pasta and then have leftovers, because this uses about 2 cups. You could use 4 cups if you were trying to feed a bigger crowd and you wanted to have a good cup of pasta with about 3 ounces of tuna. So, but I'm gonna use a little bit more than 2 cups for this one, and I am using a whole wheat fusilli pasta. But I wanted to let you know that there are so many pastas on the market right now that are so good for people with FCS. This one contains whole grain organic white winter wheat flour. So the white winter wheat is a nice choice because it has a milder taste and it does not have that darker brown color. So you're just, you know, for someone that's looking, oh, this is too, you know, whole grainy, then this is a great choice. Other choices, there are lots of pastas that are made with different flours of beans. So this is a black bean flour. You could get garbanzo bean flour, you could get pea flour, lentil flour, and they're all delicious as well. Another choice could be a whole wheat couscous, and this is a very mild product that, because of so much surface area, it quickly absorbs water and is done within 5 minutes. You don't even cook it, you just put it in hot water. So those are all choices. But I really love the white winter wheat, and I like the fusilli for this too, although you can use penne and different things, but the fusilli is good because it has more places where the mushroom soup and everything can stick. So we're just gonna stir that up. You're gonna see this is pretty much done in like less than 10 minutes, the way I do things. And again, it's something that you go, what are we having for dinner? I have nothing. I didn't go to the store. I didn't get ground turkey breast. I don't have many fresh vegetables. I almost have nothing. And you look in the back of your pantry and you have tuna, you have mushrooms, you have pimentos, and you have the cream of mushroom soup, healthy request style, then you've got it made. And you can see, this is kind of a feel-good comfort food too because of the creaminess, but I'm not sure if you can see it. I will put it in the microwave later, but it it tastes good, and I think you'll enjoy it. Oh, I didn't put any pepper in, I don't think. So let me do that. And yeah, we're done. So that is the tuna pasta en casserole. Maybe if you want to, you could put it in the oven. You could even sprinkle it with some whole wheat panko breadcrumbs to give it a crispy top. What else could you do? Maybe some flax meal you could sprinkle with, but that would add a little bit more fat. So remember, this is 3 grams of fat per serving, and this recipe makes 4 servings. So enjoy. Okay, so now we're ready for the dinner meal. And this is a special occasion kind of a meal, and very typical in Maryland that people would eat crab cakes because of course we have the Chesapeake Bay where we get a lot of crabs. So we're also using some Old Bay seasoning, which is a Baltimore spice and now owned by McCormick Spice Company, which is in Maryland. so that will give a lot of flavor. And let's see, we'll start with the crab meat. It's expensive, but you can get it on special often at the big box stores like Costco and Sam's Club. You can also find it on special at home, Whole Foods. And lastly, you can half the recipe and really find often the smaller 8-ounce containers. This is a pound of blue crab, and in 3 ounces cooked blue crab meat, there's only 1 gram of fat. So that's why it's so good for an FCS special dinner. So we're gonna put the crab meat into the bowl, and you see we have, this is a combination of different parts of the crab. So you even have some leg meat, which is very flavorful. You have the back fin part, which is a delicacy. And wow, you can just, it smells so great. So it smells like home. Anyway, so we're gonna be making, I should have said, we're gonna be making crab cakes. And they are Maryland crab cakes, and the recipe comes from Philip's Crab House, but redone my style to be as fat-free as possible. So the next thing we're gonna do is put a little bit of whole wheat bread in it. So I'm gonna process these pieces of bread just so I can get some breadcrumbs. Some people just pull it apart when they make their crab. I'm gonna process it a little bit more. And my bread was bigger than my average bread. So let's see. Sorry, that's kind of off camera a little bit, but you can see that I have just a little food processor and makes it pretty easy. Pull that out. So here are the breadcrumbs. So I'm just gonna pour those in. And then we're gonna use 2 tablespoons of fat-free mayonnaise. And I think there's only 1 company still making fat-free mayonnaise. Again, if somebody was using mayonnaise but needed an alternative and could not find this, which I did find in several stores recently, they could use the Greek yogurt, the non-fat Greek yogurt. So we're gonna do 2 tablespoons of the fat-free mayonnaise and 2 egg whites. Now, I'm gonna use egg beaters rather than separate the eggs, or egg substitute, so fat-free egg substitute. And each egg is about 3 tablespoons, which is a little less than a half a cup for 2. 6 tablespoons. So I'm gonna put that in, that will hold it together really nice. And usually the egg substitutes are really 99% egg whites with a little bit of beta carotene for color to make it look yellow, and some lecithin as an emulsifier. And I'm gonna put 2 teaspoons of my Old Bay in. I think you all will be getting these recipes, but let's see. I also use this for shrimp too when I make any kind of steamed shrimp. This just, you know, really gives it a good flavor. And I also use it for my Maryland crab soup, because anything that has Old Bay in it, even if it didn't even have crabs in it, kind of tastes, there we go, that's about right. Tastes like crab. And 2 teaspoons of dried parsley. Again, I hate when you have to go out and get things just for a recipe, but these kind of things, you know, most people, if they make these, would already have them in your pantry. A half a teaspoon of yellow mustard, which is kind of not worth measuring, but let's see what we can do. I'm gonna just stick it in here and put a half a teaspoon of mustard. I'm gonna give it a tiny bit more. There we go, that's the mustard. And 1/4 of a teaspoon of Worcestershire sauce, which I do have to get out of my refrigerator. 1/4 of a teaspoon, that's almost not worth measuring either. 1/4 of a teaspoon, sorry. I'm gonna go off camera. Remember how we're doing this very low budget, me taping myself on my phone. And we're gonna stir that up. You can see that bread and the egg will kind of hold everything together. Whoops. I realized from that first one, it kind of looked like Julia Child when I was doing that blender. But I'll try to stay neat. Now, I will need to make these into patties. So I will be using my hands, but I have been washing my hands a lot. And unfortunately, you're not here for dinner. Otherwise, I would get out some gloves and use them. Let me look through all my ingredients again. Crab, whole wheat bread, fat-free mayonnaise, egg whites or egg substitute, Old Bay, parsley, mustard, Worcestershire. And then what I'm gonna do that's a little bit different today is I'm using a tablespoon of MCT oil. And in the lecture, we kind of talked about how we purchase it, and it's better to purchase it through a pharmaceutical company like Nestle Nutrition that, you know, is more regulated than something you would get off of the internet. But I did get this off of the internet because the other one was just, you know, 6 bottles for $3.99 was a little too much. So this one said that it contains only capric and caprylic acid, which are the 2 medium chain triglycerides. So I am going to do it just in that tablespoon. When you are using MCT oil, remember to start slowly, and sometimes it could cause abdominal pain if you're using too much of it. And the other key, which I see I'm not following, is to put your temperature between low and medium. So sometimes it's going to take a little bit more time to really make these crab cakes brown in the MCT oil, but the MCT oil will give it a lot of nice flavor. So I think we've got this pretty well stirred up. And buying crab cakes in a restaurant, of course, they would put so much more breading and less crab. So these are really gonna be good because they're made by you. They pretty much have about a gram of fat. And you can get 6 patties out of it. There we go, I'm gonna put that on there. 6 patties, or you could do 4 big ones, depending how you want. You could even do it as crab balls and just bake it in the oven and make it as an appetizer. So that would be a very special appetizer. So I'm just going to do about 3 of them so we can get these cooking a little bit better. And so I don't want to run out of time. So let's see. So you can see that's a pretty good sized crab cake, but actually, yeah, I would at least get 6 out of this batter. And if you were in Maryland, you would probably just eat these with crackers and maybe some coleslaw or some corn or something. Here you can have them all year round because the crab meat is available in the can all year. I will probably have it with the light rye Wassa cracker because it is pretty much one of the only crackers that's whole grain and contains no added fat. So, and they're so tasty. So I will be doing that. So let's see what we've got going here. I don't know if you can see these. MCT oil is really fun to use if you haven't used it, if you have FCS. If you don't, and you feel like you just want to use a little olive oil or canola oil or something, that's perfectly fine also. And you can see that tablespoon, even if I had 6 in here, is really plenty. And it has 115 calories per tablespoon. So for those of you who are trying to gain weight, it's great because it gives you a little extra calories. I know some of my FCS patients have trouble keeping their weight on because the eating style is more limited. Let's see. I'm gonna turn that over. Okay, we got a little brownness going here on these crab cakes. I think Philip's Crab House would be very happy with these. They are not brown enough yet, but they're almost there. Of course, you would really want to cook them for a good, I'd say, 5 to 10 minutes on each side just to cook through thoroughly, although the crab is already cooked. And that's it for the crab cake. So have it with some coleslaw that you make with fat-free mayo or with non-fat Greek yogurt and your crackers, whole grain, no added fat, or have it as an appetizer. So I hope you enjoyed these cooking ideas and hope that you'll have some fun with cooking at home, because I know we have lots of time for it lately because we're all spending a lot more time at home and a lot less time in the restaurant and on the road. Maybe you're working from home even. So thank you for having me, and thank you for coming into my kitchen.
Thank you for that helpful demonstration, Mary. As you and I spoke earlier in the summer, tuna noodle cafe. Hello?
Excuse me, can you hear me?
Yes, hello?
Melissa? Okay,
yes.
Can you hear me? Okay,
yes.
Good.
Can
yes,
everybody
we
hear me
did
okay?
talk about that.
Yes. The tuna noodle casserole. It's been a favorite in our house since the pandemic. Just because it was so easy to keep, and I've never made it before, and I made it this summer, and it's one recipe that my entire family has asked me to make again and again.
Thanks.
So
Thanks, Melissa. That's so nice. Yeah, it's a go-to in my house too. And
yes,
not everything does my husband love, but that is one thing that he will accept. And again, 10 minutes and you're done.
Exactly. So before we take some questions from the audience, we want to conduct another poll to see if there has been any changes in knowledge. Great, thank you for your participation. As you can see, MCT oil, the question, MCT oil provides a healthy source of essential fatty acids for patients. I'll let Mary speak a little bit. I think you mentioned that in your presentation a little bit, Mary.
Right. I think that a lot of people, because they call it a supplement, they think it's a supplement of essential fatty acids, but it is not. It is really just those two medium chain triglycerides that just provide calories. And actually those two are saturated fat. So I was interested to see that, when I looked at the label, that almost all the fat in MCT oil is saturated fat. But the two that our bodies can't make, we would need to either, one have as whole grains and good healthy foods, and they'll probably get in. And then the other one, we would, either have a little chia or a little flax, and talk to your doctor and look at skin. And if you're starting to see if there were some bumps or dry, scaly skin, then, you do want to talk about it and see, if they could test levels or if a supplement's needed.
Great, thank you. We do have a question. The question is, should we supplement an FCS patient with fat-soluble vitamins A, D, E, and K?
Yes, Mary, I think that most people do supplement. What about your daughter, Juliana, Melissa? Because, we really aren't getting our fat-soluble vitamins.
Yes,
because
that's
of the very
one
low
area. We make sure that she gets a multivitamin that has that has those four. And luckily, every time she's had her levels drawn, we always do, not just her fasting triglycerides, but we also look to see how she is with those 4 vitamins. And luckily, she's always, she's never been deficient in them, but we do make sure that we supplement.
Good, good.
Yeah. Do we have any other questions? I just saw that one. You can use the Q&A over in your chat box if you have any other questions for Mary or I.
So Melissa, would you agree that when groups get together, that's the buzz is all about food and what have you found and any new products or new techniques in the kitchen? The air fryer that Juliet did last week on the LipidPALOOZA. So.
Yeah, we do. We love talking about food, new recipes, modifying family favorites. Because I think that's sometimes people get stuck as they feel like they can only find or they can only look for fat-free recipes. But like you said, and as you showed us, you can take some family favorites and just modify it. I have found that most recipes do not need the butter that it calls for, substituting applesauce for oil and baked goods, fat-free Greek yogurt, for full-fat sour cream, because I can't find fat-free sour cream anymore.
I know. So, I can't either, but doing that Greek yogurt and putting it through that coffee filter can make it just even a little richer. So you're somewhere between, you would really get the consistency of fat-free sour cream.
Yeah.
Maybe
and it's better because
it
has the extra protein.
Yes.
Right.
Yeah. That's true.
Yeah.
So I know Melissa's part dietitian. So is Lindsay. Well, Lindsay has a background in nutrition also.
Yeah. I am just, because you have to be. You have to end up being, and feeding one child with FCS and 2 kids who don't have it and making sure you're meeting all their dietary needs. You got to be creative, but you can do it. And a lot of what we do for the foundation is sharing those recipes and support with people. So if you do have patients with FCS, please send them our way because we'd love to connect with them. So that concludes our session. To find more education like this, visit lipid.org. And to find resources for your patients with FCS, you can visit livingwithfcs.org. We do have an online support group that we have patients where we can talk with each other. We're on Facebook, we're on Twitter, we're on Instagram, so we try to meet patients everywhere. And we are so appreciative for you joining us, and we hope you have a good night. Thank you.